CEO of Top Flight Defense Incorporated, a nonprofit organization created by a women veteran for all women. And today we will be discussing Polycystic Ovarian Syndrome with Dr. Goldwyn Foggie. This month is PCOS Awareness Month. So who better to come in and discuss this situation, this condition with women other than Dr. Foggie? So Dr. Foggie, I'm going to turn it over to you and let you tell everybody who you are and get started with the presentation. And thank you for coming.
Thank you for the invite, Cassandra. Hello and welcome to all of our live viewers. And for the people who came to the virtual space, I'm really glad to be here to present to you Polycystic Ovarian Syndrome. So I'm going to share my screen with you guys. For those of you who need to get into the virtual space, I think Valerie could help. I'm sorry, Cassandra could help you guys get into the virtual space. You won't be able to see my slides, but everybody else in the space can see. We're going to keep you guys on live, and then afterwards, we're going to close the live for the private Q&A. But thanks for being here. Valerie, I'm sorry, Cassandra, everybody calls me Dr. G or Dr. Goldie, right? So I am a women's health physician, and I've been doing that for about, 25 years. So I've been practicing obstetrics and gynecology. I've delivered thousands of babies. I perform women's surgery. Have been, really interested in the healthcare of women throughout the lifespan. In the last 5 to 6 years or so, I launched a wellness center called Illinois Wellness and Weight Loss Centers, and we're located in Chicago. And I am a diplomat of the American Board of Obesity Medicine, where I really am super passionate about helping people to lose weight by finding their wellness. So I help patients with their nutrition, their habits, instituting physical activity or more exercise in their lives, and then also prescribing FDA-approved medications to help them have more balanced lives. And in doing that, guess what? They're able to manage their weight. So my clients lose weight with me. Here are just a few of our success stories, and we have had hundreds since we have been open. I mostly work with women, but I have a few adolescents and a few men who find their way to me. And so we help all people in the community in search of weight loss through wellness. And so I also help clients outside of my office through my books. I just finished a book called Perfect Pause, and it's a book about finding your better health through menopause. We made Amazon's best-selling list with that. I do speaking. I have some online courses which people need to know about. Specifically, I'm really passionate about preventing diabetes through lifestyle change. So I have a course on Thinkific with that, and I have a Facebook community called Fit by Design. And this is a group of women who we held each other accountable by helping us to prioritize our fitness. Because what do we do as women, as mothers, as working girls? We tend to put ourselves absolutely last. We lose our ways, and we have to find ways to stay healthy ourselves. So as Cassandra said, September is PCOS Awareness Month, Polycystic Ovarian Syndrome Awareness Month. Through this talk, we want to discuss what is PCOS, what are some of its causes, what are some of the signs and symptoms women may have that would make the diagnosis of PCOS, and what are the health risks involved with PCOS, and are there treatments available to those who suffer from this condition? We want to be able to cover that in this talk today. So polycystic ovarian syndrome was identified 80 years ago by two gynecologists, Dr. Stein and Dr. Liebenthal. And what they found was they studied women who were suffering from fertility issues. And the women who were suffering from infertility were having problems with ovulation. And what they found was all of these women had ultrasound findings that were in common. And the findings on ultrasound were that all of these women had the presence of enlarged ovaries that were filled with small cysts. So polycystic ovaries, they look like slightly enlarged ovaries. So you won't find that they're like huge cysts from the ovaries, but there'll be like multiple small cysts located on the outside or the perimeter of the ovaries. And they have a very glistening or shiny appearance. And so on ultrasound, you can see the presence of the cystic structures on the ovaries, and what they're indicative of are follicles or eggs that are not ovulating regularly. And as a result of these eggs not ovulating, they are retained inside the ovaries and they form little tiny cystic fluid-filled structures called cysts. Thus, the name Polycystic Ovarian Syndrome. Okay. So let's see if we can get the next slide here. All right, so, here's a pretty uterus here, lots of flowers on it, but, you can see this ovary here just has multiple unovulated or unreleased eggs that form this cystic structure. So what exactly is polycystic ovarian syndrome? It's really like a heterogeneous disease. It's really diverse. It doesn't always present in the same way. It's sort of like multifactorial. You could have few symptoms and then you could have like many symptoms, and all, are the same disorder. There tends to be a family history of it. So it tends to run in families. There are various lifestyle factors that are associated with PCOS, but there's no universally accepted definition of PCOS or polycystic ovarian syndrome. So here's a picture of me at the grand opening of my center, and this is my sister, my baby sister. I'm actually like 9 years older than she, and we both have PCOS, right? So when I think about it, I don't think there was a doctor that ever diagnosed me personally with PCOS, but going through medical school and going through residency in OBGYN, I said, wait a minute, I'm having these symptoms. I'm having these symptoms of missing some periods. I'm having these symptoms of, having trouble losing weight. I'm having these symptoms of, just these things going on in my body. Maybe that's what I have. So I diagnosed myself as a resident gynecologist. And when I look at the things that my sister went through as she went through puberty, I'm pretty sure she had the same diagnosis. So what do we have in common? Genetics, right? We share 50% of the same genes. Both of our parents have type 2 diabetes, and I can see the traits in the women of my family, which makes me, it just confirms that PCOS is exactly what we suffer from. So what's the unique thing that all women with PCOS have? The hallmark of it is an imbalance of hormones, the sex hormones to be exact. So androgen is the hormone that women with polycystic ovarian syndrome will have elevated levels of. So, the body makes all kinds of hormones, right? The ovaries are where women will make the sex hormones, and the adrenal glands will make just a little bit of androgens, or the male sex hormone, shall we say. In men, these hormones are produced by the testicles, right? In women, produced by the ovaries. So women with PCOS will have elevated levels of this androgen hormone. Now, there are other things that can elevate your androgen hormones, such as congenital adrenal hyperplasia or adrenal tumors. These are less common, but polycystic ovarian syndrome is the most common reason why women will have elevated levels of androgen. So the National Institute of Health says, you know what? There are two things that must be present in order to make the diagnosis of PCOS. And these are excess or increase of androgen hormones, that's the hallmark. And number two, a woman must have chronic anovulation. And how can chronic anovulation like present itself? It usually presents itself sometimes during menarche, when a woman starts her reproductive life, where she may skip periods all the time, or she's like having a few periods or skipping a few periods, or sometimes a woman could go like months or years without having regular periods. As a result of not ovulating, she doesn't have the withdrawal of the uterine lining, and so she doesn't shed that lining regularly, and she won't get regular periods. So these two things must be present in order for a woman to be diagnosed with polycystic ovarian syndrome. So, as I mentioned before, the androgens are sex hormones, right? So women have sex hormones, men have sex hormones. We need androgen to help us start puberty. When we go through puberty, what starts to happen? We start to get telarchy, and we start to get, we start getting underarm growth of the hair. We start to grow hair on the pubic area. Well, this is caused by androgen, right? And so women with excesses of androgen production may notice a different pattern of growth of the hair in these areas. So what causes the increases of androgens in women with polycystic ovarian syndrome? Now, this is important to know. Insulin, which is a hormone made by the pancreas, the responsibility of insulin is to take our blood sugars, bring the blood sugars into the cells where it can be used. So insulin lowers blood glucose levels. When insulin levels are elevated, what that does is it causes a decrease in the amount of a protein that combines with androgens in the blood. So if you have the absence of this protein called sex hormone binding globulin, then you have a lot of free androgens in the bloodstream. So you have a lot of excess androgens floating around in the bloodstream, and it causes it to be more biologically active. So when people have elevated insulin levels, they will have increase in androgen levels, which cause or contribute to polycystic ovarian syndrome. So increases in insulin levels will cause or increase the risk of insulin resistance. Now, there are a few different types of diabetes. There's type 1, there's type 2, there's type 3. Type 1 is when your body has an autoimmune response against the cells in the pancreas that make insulin, right? And so therefore, a person's not making enough insulin, and they need to get insulin added back into the body. Type 2 is when you are making enough insulin, but guess what? Your diet is such, or genetically your risks are such, that your body is seeing a lot of extra glucose in the bloodstream. And as a result, you're making more insulin to lower the glucose levels. And basically, the cells get overloaded. The body can't handle it anymore. And your cells become resistant to the insulin that you're producing. The third type of diabetes occurs during pregnancy, and that's called gestational diabetes. For the purpose of this talk, we'll be discussing more of type 2 diabetes. So insulin resistance, again, think of insulin as the gatekeeper to the cells. When we consume glucose, carbohydrates in the form of glucose. Now, carbohydrates come in all different types, right? We have good carbohydrates and we have not so good carbohydrates. The really good carbohydrates that we consume are the ones that have tons of fiber, tons of protein, tons of vitamins, and tons of water. That's our fruits and vegetables, right? And our healthy grains. But in the American way of life, we tend to eat a lot of processed sugars, a lot of refined sugars. We eat tons of junk food and foods that are like too rich in sugar. And so as a result of those types of carbohydrates or glucose, what happens is the body gets overwhelmed with the amount of sugar that it's receiving. Your insulin no longer can get the glucose inside the cells where it belongs. And so we have excess glucose inside the bloodstream, okay? So excess glucose inside the bloodstream because the cells are resistant to the action of the insulin. That's insulin resistance. So excess weight can amplify this effect. Okay, because when we have excess weight, it tends to be because it's related to our consumption of excess glucose or carbohydrates. That's the tendency. So insulin resistance again comes when we have excessive carb loads. We're eating too much candy, too much sugar, too much junk food, too much processed sugars. Okay. Insulin resistance can come from genetics. You can have a very healthy diet, but genetically, you're predisposed to insulin resistance because it runs in your family. Insulin resistance can come from being sedentary. We're not moving enough. When we exercise, glucose is pulled into the muscle cells and used. When we don't exercise, that's not going to help us to move glucose like we should. And then again, excessive weight will drive the increase of insulin resistance. And as a weight loss specialist, this is what I drive home every day with my patients. So having insulin resistance is terrible for our health. It increases the risk of polycystic ovarian disease. It increases the risk of fatty liver disease. It causes an abnormal lipid panel, your cholesterol levels. The good cholesterol tends to go down, and the bad cholesterol has a risk of going up. Insulin resistance causes issues in the GI tract. We tend to have more gastroesophageal reflux disease, more heartburn. We have more constipation. Insulin resistance can alter our blood pressures, increasing the risk of hypertension. I see a lot of patients who have high blood pressure and they say, I don't know how this happened. I don't have any family history. Why is my blood pressure high? Perhaps it's their lifestyle. The presence of insulin resistance is driving metabolic abnormalities in their bodies. Again, insulin resistance can cause elevated blood sugar, requiring treatment of type 2 diabetes or pre-diabetes. And insulin resistance also causes the body to store more fat. And the storage of the fat in the central abdominal area is the hallmark of insulin resistance. All the things we don't want, right? So we need to figure out, how do we get rid of insulin resistance? So I'm going the wrong way here. Let's see. So, anovulation. We're not ovulating regularly as a result of those increase in androgens, right? So menstrual irregularity can take the form of skipping periods, but it can also take the form of having heavy bleeding when you do get periods. So the gynecologist needs to evaluate menstrual irregularity to rule out polycystic ovarian syndrome. And sometimes the gynecologist will prescribe things to regulate a woman's cycle based on whether or not she wants to conceive or not.
Dr. G, you are muted. Unmute yourself. There you go.
Okay, we're good. All right. All right, so let's see if we can get this together. So people with polycystic ovarian syndrome may or may not suffer from infertility. If we ovulate once a month normally, but you're not ovulating because of PCOS, then your opportunity to conceive is going to be decreased. So you don't have 12 opportunities a year to get pregnant. You may have 6 opportunities a year to get pregnant, or even less. And so women with PCOS sometimes find themselves in reproductive health or gynecologic endocrinologist office trying to conceive. There are definitely things that can be done to help women to conceive, medications to take to induce ovulation, and other assistive reproductive technology. Acne is a common feature of PCOS. Why? Because excessive androgens will present in the skin in the form of acne. And also the presence of moles or nevi. People with PCOS will tend to have an abundance of the presence of nevi or moles on the skin, okay? And so that's very prominent with PCOS due to insulin resistance. And also hirsutism. What's hirsutism? This is a very exaggerated slide, right? Hirsutism is excessive hair in areas that women don't want hair to grow. We don't want hair to grow on our chins, underneath our noses, above our lips. We don't want excess hair in the pubic area, in the inner thighs or on the lower belly. These are areas that tend to be stimulated by the excessive androgen levels. And, it can be very bothersome for women. So women may seek doctor's cares because, they're like, why am I growing all this hair? And I'm plucking all the time, or I'm using depilatories all the time, or, maybe they even need laser hair removal. But hirsutism is a feature of PCOS. And then acanthosis nigricans. This is a condition where people will present to the doctor and you'll say, hey, the back of my neck is very dark. It's really dark. And it's kind of like it has a thick velvety appearance. You also can have that thick velvety appearance or darkened appearance on the underarm, on the inner thighs. This is very indicative of insulin resistance, and this is how it tends to present. 80% of women with PCOS are struggling with their weight in some way, finding it hard to lose weight or to maintain their weight. But that means 20% of women have no weight issues at all. So you see how it's very diverse, and one size does not fit all, and women do not present in the same way. So what's the prevalence in the population? Like, what does it look like? It is the most common reproductive or hormonal abnormality in reproductive age women. So maybe up to 4 to 20% of women have PCOS. That's about 200,000 new cases that are diagnosed every single year. But this is the kicker. 75% of women aren't even diagnosed with PCOS. They have it and their doctors don't diagnose it. And why? Because doctors may not recognize all of the signs and the symptoms, and so they don't screen for it adequately. What did I tell you before? I pretty much diagnosed myself. I never went to a gynecologist that said, hey, I see this in you or that in you, or what's going on here? Maybe you have PCOS. And that's what doctors need to do. We need to be careful to take really good histories and do physical examinations so that we can diagnose women, so that we can help women get treated. So where do we see it? We see it in reproductive age women. Somewhere after puberty, after a woman has started menstruating, typically age 16 to 50 years old. We don't see it in young women or young girls before menses. Very rarely do we see it in kids. Very rarely do we see it in menopause. So if you're menopausal, this is not your story. You are not going to have issues with PCOS symptoms. But how is it diagnosed? How does a doctor diagnose PCOS? Because there's no genetic test that's done when a baby girl is born. When a woman starts getting pap smears, she goes for a test. No, there's no genetic test. And actually, what a doctor needs to do, as I said, you need to discuss the symptoms that your patients are having. You need to do like thorough physical exams and note, is this person, have excess hair here or here? Does this person have any signs of acanthosis nigricans? Does this person give me a history of like skipping periods all the time? Is this person suffering from truncal obesity or excess weight in the midline or finding it hard to lose weight? Maybe your doctor needs to do some blood tests to rule out insulin resistance or diabetes or prediabetes. And finally, maybe your doctor needs to do an ultrasound because an ultrasound of the pelvis can reveal if there's the presence of multiple unovulated cysts in the ovaries. But it's not the standard to get ultrasounds anymore. But I have to say, doctors need to put all the information together in order to get a great diagnosis. So people with PCOS, like, what are they at risk for? What are we at risk for? Why do we need to identify it? Because what can happen if we don't? Women with PCOS have a 2 to 5 times increased likelihood of being diagnosed with type 2 diabetes, okay? Because of the insulin resistance. So women with PCOS are more likely to need some type of lifestyle intervention, because just because you have it doesn't mean that you have to suffer from the sequelae of it. Maybe you need to exercise more. Maybe you need a good prescribed nutrition plan, low in simple carbohydrates. Maybe you need to take medications that will sensitize the body to your insulin or glucose, such as metformin. So women with PCOS are more likely to develop gestational diabetes when they do get pregnant. There are increased cardiovascular risk with PCOS, such as increased risk of atherosclerosis or developing fatty plaques in the arteries. This is why we need to really intervene. Women with PCOS need a regular exercise plan. In order to increase good cholesterol, you need a low carbohydrate diet. You need to eat a diet rich in omega-3 fatty acids. Those are our good fats, our olive oils, our sunflower seeds, our walnuts and fatty fish and things of that nature to lower the risk of atherosclerosis and heart attacks. And as we know, heart attacks are the leading cause of death in Americans. Hypertensive diseases. Women with PCOS are more likely to have high blood pressure, okay? Because the metabolic disturbances will increase your blood pressure. It could be intermittent or it could be like sustained. Women who get pregnant who have PCOS are at risk for preeclampsia. So preeclampsia is higher in women with PCOS or metabolic disturbances such as insulin resistance. And this is why it's so important that doctors make the diagnosis so we can avoid these illnesses. And then endometrial hyperplasia. That's a condition where the lining of your uterus is abnormally thickened because you're not shedding it regularly like you need to. And as a result of endometrial hyperplasia, there could be an increased risk of developing endometrial cancers. And so women with PCOS need sometimes the regulation of their menstrual cycles with hormonal birth control to ensure that the lining of their uterus is shed regularly to lower the risk of endometrial or uterine cancers. This is quite important. And then, as I said, in infertility, women can see reproductive endocrinologists now, receive ovulation induction medications and other assisted reproductive technologies. We have ways There are ways that women can conceive, so you don't have to suffer infertility just because you have PCOS. So again, here are the things that women with PCOS can suffer from, and this is why we need to make the diagnosis, why we need to treat it, okay? How do we treat it? Lots of ways. Prescribed hormonal birth control, low cholesterol diets or statins, medications if necessary, intensive lifestyle intervention. I am an advocate of lifestyle medicine, getting people to exercise and change their diet as a way to prevent disease and illness. We love doing that at our center. Spironolactone is used to lower androgen levels to help people with their acne. And then, of course, there's laser hair removal, electrolysis, and all of those things to have a more beautiful aesthetic appearance. And then artificial reproductive technology to help women to conceive. And weight loss. I want to stress the issue that if you are having overweight or obesity, losing weight can improve, ameliorate, they can lessen your symptoms of PCOS. And so weight loss is often recommended to help people with PCOS to improve their symptoms, okay? Just losing 10% of the body weight can help it. And now this is a huge issue because in our culture, it is in vogue to be beautiful, to accept your curves, and to be bold and feel good about, every size, beauty at every size. And I'm an advocate of beauty at every size. But if that size is contributing to or leading to or increasing the risk of metabolic disturbances in the body, then we have to address the weight. And so weight reduction is important because it lowers androgen levels when we lose weight. It improves the chances of getting pregnant when you lose weight. It lowers your glucose levels. So people who are trying to get their glucose levels in check, like with people with type 2 diabetes, they lose weight, glucose levels improve. And also your cholesterol levels can improve. Dyslipidemia or abnormal cholesterol levels are a huge contributor to heart disease and heart attacks. So losing weight can help with all of that. And then reducing the appearance of hirsutism or excess or unwanted hair. That's important, and weight reduction does it all. So people with insulin resistance go on low carbohydrate diets, exercise more regularly. They can take FDA-approved medications to help with that. And then even bariatric surgery, if you qualify, is a good way to improve insulin resistance, which will help with PCOD. So in conclusion, polycystic ovarian syndrome is one of those things that's so diverse, it's so heterogeneous, it presents in so many ways. You could have few symptoms, you could have none at all, you could have tons of symptoms. It comes in every size. It's impossible to know just by looking at a person whether they had that. So it's important that we, as healthcare providers, physicians, nurse practitioners, physician assistants, that we do our jobs by making an adequate diagnosis, taking a great history, and not ignoring the opportunity to do a great physical examination, and then getting the necessary tests to confirm PCOS, and then we intervene early to help our clients to resume ovulation, lower the risk of diabetes, avoid heart disease, endometrial cancers, and all the possible sequelae of PCOS. So I am very happy to entertain questions at this time. And so we're gonna stop our live and we're gonna do questions in the Zoom. If you guys are interested in getting the link, you consult Cassandra about that, but we're gonna pause our live right now and then we're gonna get to questions.
All right, thank you so much, Dr. G. Thank you. I don't see any questions out here on Facebook Live. So what I'm going to do, I'm going to stop Facebook Live. because I don't see anything here, and we'll just do our discussion here on Zoom.
Sounds
Okay.
good. Yes, that's good.
Okay, but I have to do my little commercial break.
Okay.
Okay. So once again, Top Flight Defense Incorporated, this nonprofit organization, works with ensuring that women's health and wellness is the top of your list. And by doing so, we come on Facebook Live and or Zoom to acknowledge or to talk about the health awarenesses for that particular month. So next month, being October, is Breast Cancer Awareness Month. We will have several classes going on for that month. We also have Social Security Administration that comes on every fourth Wednesday of the month, and they talk about the benefits that Social Security has. We were supposed to have one today, but unfortunately, they weren't able to come on, so that's fine as well. And then plugging in for March, mark your calendar, March of next year, the last Saturday, we will be hosting our annual women's conference called Let's Talk About Us. The theme for next year, drum roll please, is sex, lies, and alibis. Not what you think, but it is what you think. So I thank you to everyone on Facebook that are watching, and we will sign off on Facebook Live. Okay, we stop Facebook Live. I'm going to also stop the recording.